This program is about care of the diabetic patient. After viewing this videotape, you will be able to describe the 3 areas in the circle of control for the diabetic patient, describe the 2 types of diabetes, list 3 important points in the personal care of the diabetic patient, and define hypoglycemia and its treatment. At key places in this video, we will pause and ask you specific questions about what you have learned. If you can answer the questions, you are ready to continue. Should you have difficulty answering the questions, please rewind the tape and review that section again.
Hi, Nancy.
Hi.
I hear I'm getting a new patient.
That's correct. We have a new patient, Mrs. Gladys Henson, who will need an aid. She's a diabetic who developed a bad case of the flu last week and ended up in the hospital with ketoacidosis. She's prone to hypoglycemia and will need a little extra attention until she adjusts to the changes that her doctor has made in her insulin dosages.
I'm looking forward to taking care of Mrs. Henson, but I've never taken care of a diabetic patient before.
We have a new videotape which may help you. Do you have time to watch it now?
Yes, I do, and I'd like to learn more about diabetes, for I have a diabetic neighbor, and I always feel a little bit nervous when he's around, not knowing exactly what can happen.
Well, this videotape should help you.
Thanks. I really appreciate the extra help you're giving me.
That's what I'm here for. You, me, and our patients, we all work together as a team to ensure quality care. If you ever have any questions, problems, concerns, don't hesitate to give me a call. So let's watch the videotape.
Hello. I'd like to tell you a story about a dear little girl named Kelly. Kelly turned the corner from the terrible 2s to become a 3-year-old charmer. The joy of doting parents who savored her boundless energy and playful antics. But in the last few weeks, Kelly's behavior changed and her parents worried. She began to wet her bed at night. She drank more water than ever, but her thirst was never quenched. She was always hungry, begging for sweets. Yet she was losing rather than gaining weight. Kelly was increasingly tired and listless and just couldn't seem to bounce back. A trip to Dr. Brennan provided answers along with tons of questions. There was sugar in Kelly's urine, not a normal finding. Higher than normal sugar in her blood confirmed that Kelly had diabetes. Treatment began immediately and will continue for the rest of her life because there is no cure for diabetes. Kelly's mom was overwhelmed. Her own mother had been a diabetic, but she never thought it would affect her daughter. Dr. Brennan ordered insulin and a special diet. While he made sure her mom understood the seriousness of Kelly's condition, he was also reassuring. With proper management, Kelly would be able to play and live like any other child. He discussed diabetes and the special daily care and attention that is necessary to control symptoms. Kelly's mom plans meals, gives insulin, monitors Kelly's blood sugar and activity, and watches for signs of trouble. Kelly will gradually learn to take responsibility for these things herself. She will need close follow-up with routine health checks. As she grows, she will need guidance to regulate blood sugar so she can participate in sports, enjoy treats on special occasions, and manage when her body is stressed by sickness, injury, or even emotional upheaval. Dr. Brennan made arrangements for further counsel by a diabetic educator. He emphasized that professional help was always available to answer questions and concerns as they came up. Kelly is a precious child, living a full and happy life, different only because she is dependent on insulin and a carefully controlled lifestyle. Would you feel overwhelmed if you were Kelly's mom? Diabetes is a common disease. 1 out of every 20 people has some form of it. In your work, in your neighborhood, maybe even in your family, you will face diabetes. This videotape will help you understand the condition and how it is managed. It will help you care for and relate to those who live with the occasional ups and downs of this complicated disease. Diabetes is a disease related to food and energy. Insulin is a hormone produced by the pancreas, which enables the body to use sugar. Nutrients in food, broken down in the simple sugar called glucose, supply the body's fuel. When we eat, glucose is absorbed and builds up in our blood. In response, insulin floods into the bloodstream. Like doormen, insulin opens cell doors to let glucose in to be used for energy or changed to fat for storage. In diabetes, the doorman is missing or the door does not open properly. This is because the body can't produce enough insulin, or the insulin it produces doesn't do its job. Cells have no fuel to function. While locked out, glucose rises in the bloodstream. There are two types of diabetes. About 10% of diabetics have type 1 like Kelly. This is called insulin-dependent diabetes or IDDM. They produce little or no insulin. The cause is unknown. It may be that the cells which produce insulin are destroyed by a virus or are attacked by the body's immune system. Stress may be a factor. Type 1 diabetes usually occurs in young people and often runs in families. Symptoms usually appear quickly. They include increased hunger, increased thirst, increased urination, sudden weight loss, and fatigue. Type 1 diabetics must take insulin injections. 90% of diabetics are type 2. This is called non-insulin dependent diabetes or NIDDM. These diabetics don't produce enough insulin or their bodies can't use it properly. Type 2 diabetes is most likely to occur in people over 40 years of age who have a family history of diabetes, had diabetes during pregnancy, have poor eating habits, or are seriously overweight. Symptoms usually develop over a long period of time. They range greatly and may even be absent altogether. Symptoms include increased hunger, thirst, and urination, blurred vision, fatigue, numbness or tingling in hands or feet, frequent infections, slow healing cuts or sores, and impotence. This type of diabetes is treated with oral medication and/or diet and exercise. The diabetic must maintain a delicate and careful balance between diet, exercise, and medication. Each serves a special purpose. Picture diabetic management as a circle, with each area of diet, medication, and exercise of equal importance. Even a slight change in one area will upset the others. For example, exercising more than usual burns extra calories and will cause a drop in blood glucose. If the diabetic does not return to a circle of control, there can be problems. A treatment plan only works when each area is carefully balanced with the others and monitored by the physician. Keeping blood glucose levels as steady and as close to normal as possible will help avoid emergency situations, prolong life, and increase its quality and enjoyment. Good control will prevent or reduce many of the long-term problems associated with diabetes, such as heart attacks, strokes, kidney trouble, and blindness. Now let's discuss the three areas of diabetic management more fully: diet, exercise, and medication. Diet is designed according to a person's daily activities, medication schedule, calorie and health needs, and lifestyle. Some type 2 diabetics control their disease with diet alone. You play an important role in your patient's diet. Assist your patient to plan menus and keep records of what is eaten, when, and how much. Help and encourage your patient to follow the diet precisely to promote better control of blood glucose levels, more efficient use of insulin, weight control by monitoring calories. Meal planning may seem confusing at first. Your patient has a diet plan based on exchange lists. This system divides food into 6 groups: starches and breads, meat and meat substitutes, vegetables, fruits, milk and milk products, and fats. Food in the same list can be exchanged without upsetting the diet. A 7th group contains free foods, those that contain 20 calories or less. They can usually be eaten in any amount. The patient's diet plan lists the number of exchanges for each meal. This helps the patient get the right kind of food in the right amount at the right time. Your patient may receive between meal snacks. These snacks, eaten at the same time each day, help maintain a steady balance of glucose and insulin. Remember what's best. Sugar has no nutrient value and is loaded with calories. It's absorbed quickly, overloading the bloodstream with glucose. Read food labels carefully when shopping. Avoid foods with corn sweeteners, syrup, honey, fructose or dextrose high on the ingredient list. They are all forms of sugar. Sugar-laden foods include baked desserts, ice cream, jelly, and sweetened cereals. Saturated fats may lead to heart disease and high blood pressure. Substitute liquid unsaturated fats. Foods with high saturated fats include meat and dairy products, lard, butter, solid shortenings, salad dressings, coconut and palm oils, and chocolate. Sodium in salt causes the body to retain water and can lead to high blood pressure. Use less salt in cooking. Encourage your patients to add less salt at the table. High fiber foods help lower blood sugar. They include whole grain breads and cereals, dried beans and peas, fruit and vegetables. Exercise is the second area of diabetic management. Exercise helps insulin work more efficiently, enables the body to burn glucose faster, allowing better control of blood glucose, helps to achieve and control desirable body weight by burning off calories, and increases energy level. Regular exercise, the same amount and type every day, is important. Your patients will probably have some limitations. Their exercise plan may simply be range of motion, but this too is important. Help them maintain control by following their plan. The third area of management is medication. Type 1 diabetics do not produce enough insulin and must inject insulin every day in order to survive. The doctor prescribes the type and amount of insulin and a schedule that is best for each person. They may take 1, 2, 3, or even 4 injections of insulin every day. Injections must be taken on time. There are 3 types of insulin: short-acting, intermediate-acting, and long-acting. Each type has a different activity curve: how fast it works, how long it lasts, and when it is most active. It is important to serve the patient's meals and snacks on time to avoid any imbalance. Discuss any questions with your nursing supervisor. About 2/3 of type 2 patients manage their diabetes on exercise and diet alone. The rest use oral hypoglycemic medications to increase the amount of insulin they already produce and help it work more efficiently. Oral medications also have activity curves, timed to agree with the meal plan. Again, the balance is critical. Medications and meals must be on schedule. Let's take a break and discuss what we've learned. What are the 2 types of diabetes? How are they different? What are the 3 areas in the circle of control of diabetes management?
Well, Jennifer, what do you think?
I think I really learned a lot, but what impresses me most is the importance of diet and exercise.
Not only are diet and exercise important in the diabetic, but you and I and really everyone needs to be concerned about those things.
I should apply what I've learned. I skipped a meal this morning, so I think I'll stop at Sam's Drive-In on the way home for my favorite meal of a triple cheeseburger, fries, and a soda.
Boy, that sounds great. But do you remember now that your diabetic patient couldn't join you in that meal?
That's right.
Cheeseburger, 1,000 calories, loaded with salt. Soda, loaded with sugar.
But I did learn a lot in this section, though.
Well, there's still some more to learn. So let's continue on with the video.
Okay.
Overall healthy habits and good personal hygiene are important to all of us. However, they can be critical to the well-being of the diabetic. Diabetes can cause many changes in the body. Their circulation is often poor, so diabetics should not smoke. Decreased vision makes them more prone to bumping or tripping accidents. Keep walkways clear. The diabetic should always carry an identification card or wear an ID bracelet or necklace to inform others in case of an emergency. Mouth care with gentle brushing and flossing will help prevent gum infections. Assist your patient with a daily bath. Diabetics take longer to heal, and even minor skin irritation may result in infection and serious complications. Make every effort to protect skin and avoid scratches, cuts, bruises, punctures, or other skin damage. Wash a scrape or cut immediately with soap, rinse, and cover with a dry, sterile bandage. Never use harsh chemicals. If a cut or abrasion doesn't begin to heal in 24 hours, or if it becomes infected, tell your nurse. Redness, swelling, heat, or pus indicates infection. Report any problems to the nurse and document on the visit flow sheet. Diabetics need special foot care to prevent problems. Poor circulation may make nerves in their feet less sensitive to pain, so they may not be aware of an injury or temperature changes. Wash and check feet daily. Use a mild soap and lukewarm water. Dry them gently but well, especially between the toes. Use lanolin lotion or petroleum jelly to soften dry skin. Never put lotion between the toes. If your patient's feet perspire, use foot powder. Have your patient wear clean stockings every day and comfortable leather shoes that fit well. Encourage foot exercises to increase circulation. Report any open area, change in color or temperature, swelling, or sign of infection. Your patient should not walk barefoot, wear garters or hose with elastic tops which impair circulation, or use hot water bottles or heating pads. They may sustain a burn and not know it. Do not try to remove corns or calluses. A nurse or podiatrist usually trims toenails. The diabetic also needs regular monitoring. The diabetic should maintain blood glucose levels within the normal limits of 70 to 140 milligrams per deciliter. Monitoring glucose levels and keeping good records of test results tells the patient, doctor, and caregivers how the daily schedule is working. It also helps to avoid emergency conditions associated with blood glucose that is very high or very low, and directs what to do in an emergency. If levels are slightly high or low at certain times, the doctor may want to make changes in the diet, exercise, or medication routine. Urine testing for sugar, once very common, is less helpful. It shows excess glucose in the urine, but does not indicate blood glucose levels. Ketone monitoring is also important. The presence of ketones in the urine may be the first sign of serious complications. The physician may order urine ketone testing when blood glucose levels are over 240 milligrams per deciliter, or if the patient has a cold, flu, infection, or illness. The patient should keep accurate records of the test results. You may be assigned to do the ketone testing. If so, stop the tape now and review the procedure with your nursing instructor. You should note 3 serious conditions that occur when the daily routine is unbalanced and control unravels. Hypoglycemia, or low blood sugar, is sometimes called an insulin reaction. It results when blood glucose falls below 70 milligrams per deciliter. It happens suddenly, in minutes, or a few hours. Hypoglycemia occurs when one or more of these factors upsets the balance. A diabetic person eats too little food or skips a meal or snack, gets too much exercise, or takes too much insulin or oral medication. Your patients may experience lightheadedness, hunger, a fast pulse, shakiness, nervousness, pale skin, or numbness and tingling of the mouth. They may have nausea or a headache, be cold and sweaty, confused or moody, or have trouble walking or seeing clearly. If possible, they should test their blood glucose. If treated immediately, hypoglycemia is easy to correct. A diabetic who has one or more of these symptoms should eat or drink something sugary to raise their blood glucose back up to where it belongs. Even if they can't test their blood glucose, it's better to have it a little high than let it get too low. Give fast-acting sugar, such as 4 ounces of regular soft drink or fruit juice, or 2 teaspoons honey or syrup. Most patients have concentrated glucose tablets or gel prescribed. Gel is squeezed into the patient's mouth just inside the cheek. Know where it is kept. If you are permitted to administer gel, your nursing instructor will show you how. During a hypoglycemic episode, stay with your patient. If mealtime is more than an hour away, give a protein and complex carbohydrate snack, such as crackers and cheese, or a glass of skim milk. Always inform your supervisor when an incident occurs. Be sure to record exact times, what was given, and the patient's response. When not treated immediately, hypoglycemia can cause seizures, unconsciousness, and coma, emergencies that require hospitalization. Act quickly and responsibly. Patients who are unconscious or unable to swallow may require an injection of glucagon, a prescription drug that increases blood glucose. A glucagon emergency kit includes everything needed for a hypoglycemic emergency. Know where the kit is kept. A person who has been instructed in glucagon injections, such as a family member or nurse, should administer it immediately, or seek other emergency help as instructed by your supervisor. Hyperglycemia, or high blood sugar, results when blood glucose levels climb to 240 milligrams per deciliter or above. This usually happens slowly and is not an emergency. But if blood glucose stays too high over a period of time, it may cause very serious eye, heart, and kidney problems. In a type 1 diabetic, hyperglycemia can lead to ketoacidosis, a serious medical emergency. Hyperglycemia happens when one or more of these factors occurs. A diabetic person eats too much food, gets too little exercise, doesn't take enough insulin or oral medication, gets sick, or is under unusual stress. Symptoms include increased thirst, increased urination, drowsiness, irritability, visual disturbances, frequent infections, or slow healing cuts or sores. The physician and nurse will help the patient return to the circle of control and get back on the prescribed daily routine of diet, exercise, medication, and blood glucose monitoring. Ketoacidosis is dangerously high blood glucose, an emergency that usually requires hospitalization. It can happen very quickly, especially to people with type 1 diabetes who have colds, flu, infections, or other illnesses that unbalance their daily routine. Ketoacidosis occurs when there is not enough insulin to move glucose into cells. Fat is broken down for energy, forming poisonous ketones. Ketones build up in the bloodstream and spill over into the urine. High ketone levels cause ketoacidosis. Symptoms of ketoacidosis include extreme thirst, frequent urination, stomach pains, nausea or vomiting, and fruity-smelling breath. If the blood glucose is above 240 milligrams per deciliter and there are ketones in the urine, the patient needs emergency help. Unless the condition is treated fast, the patient becomes gravely ill and may even die. Take a minute now to discuss the emergency plan for the patient with ketoacidosis. Let's pause to look at what we have learned. What are the do's and don'ts of diabetic foot care? Why is urine ketone testing important? What is hypoglycemia? What are the symptoms? How can you treat it? What is hyperglycemia? What is ketoacidosis? What is the treatment for ketoacidosis? Diabetes might not be your patient's primary problem, but whatever their illness or condition, the diabetes will affect their treatment. Your patient's care plan will provide information and directions for all care. Know the warning symptoms and emergency actions to take. Be alert for complications. It is often the scrupulous care and vigilant actions of alert and informed caregivers like you who have made it possible for diabetics everywhere to overcome distressing complications of their disease and look forward to full and happy lives. Remember to discuss with your nursing supervisor any questions or problems that come up regarding your patient's management or level of control.
This is very helpful. I feel really prepared now.
Good. That's what I was hoping for. You know, it's not only important to understand what you're doing, but why you're doing it.
Yes, I believe so. I'm looking forward to taking care of Mrs. Henson now.
Well, good. Then I'll be looking forward to seeing you there tomorrow.
Yeah, I'll see you then. I'm off to Sam's Drive-In now for a salad.
Okay.
As Jennifer makes her first visit to Mrs. Henson, we can see how she puts the information from the videotape into practice for the care of the diabetic patient. Jennifer arrived at Gladys Henson's home at 8 the next morning. Jennifer took a minute to introduce herself to Mrs. Henson while Nancy finished some admission paperwork. One of the most important parts of the admission process is the patient's Bill of Rights. Home care providers have an obligation to protect and promote the rights of the patient. Nancy explained the Bill of Rights to Mrs. Henson. The home health aide must incorporate these rights into the performance of their duties and responsibilities. There are two very important rights which directly affect care delivery by the home health aide. The patient has the right to confidential treatment of the medical record. Jennifer knew that her documentation on the home health aide flow sheet was part of that record, and she had to treat it as confidential. Confidentiality also extends to what Jennifer sees and hears. This is privileged information, and she cannot share it with relatives or friends. The patient has a right to participate in planning the care and treatment. For Jennifer, this meant that she would encourage Mrs. Henson to make decisions about her care. Jennifer would ask Mrs. Henson if she wanted a bath before or after breakfast, or what type of sandwich she wanted for lunch. During the admission process, the nurse completes an assessment of the patient and the environment. This assessment gathers information which assists the nurse in establishing the care plan. Nancy and Mrs. Henson worked together on the care plan. They identified Mrs. Henson's problems or needs. Her needs focused on the circle of control. Her goals were to return to a precise and careful balance between medication, exercise, and diet, and to become independent in the management of her diabetes. And they discussed the interventions or actions the home care team would take in assisting her to achieve the goals. The home health aide plays a key role in putting the care plan into action. We will look at each area of the care plan more closely and see how the nurse translates the care plan into activities for the home health aide. Through the aide assignment, the home health aide works to help the patient reach goals. The first need identified for Mrs. Henson was related to insulin. She was not taking her insulin as the doctor had prescribed. Although insulin administration and teaching would be the nurse's responsibility, Jennifer would assist in getting the supplies and putting them away. The second need was exercise. Mrs. Henson was still very weak as a result of the hospitalization. The nurse assigned Jennifer to assist Mrs. Henson with most activities of daily living, including personal hygiene and foot care. Her exercise plan, for the time being, was range of motion exercises. As she became stronger, the doctor and nurse would reevaluate the exercise plan. Changes in the exercise plan could also mean changes in diet and insulin, so Jennifer would watch for revised instructions. The third need was diet. Mrs. Henson never really knew how to use the exchange lists, so she would count on Jennifer to do the meal planning. The nurse would teach Mrs. Henson more about the exchange lists. Because Mrs. Henson had not eaten breakfast, Jennifer would prepare it. The meal plan stated that, for breakfast, Gladys could have one exchange each from the starch, meat, and fruit lists, and 1/2 exchange from the milk and fat lists. As Jennifer studied the food exchange lists, she asked Mrs. Henson her food preferences. Would she like bread or cereal from the starch list? Cheese or an egg from the meat list? What type of fruit would she prefer? Jennifer then wrote down the exact amounts from the list. 1/2 cup bran flakes. Jennifer realized that measuring foods would be very important. 1 egg. Gladys liked a poached egg. 1/2 grapefruit. 1/2 cup milk. And 1/2 teaspoon margarine. Mrs. Henson mentioned that she always used a sweetener on her grapefruit. There are 2 types of sweeteners, those with calories and those without calories. Sweeteners such as fructose, mannitol, and sorbitol contain calories and should not be used by the diabetic. Sweeteners such as saccharin and aspartame do not contain calories and can be used in moderation. Mrs. Henson would use a sweetener with no calories. The care plan also focused on 2 complications Mrs. Henson had experienced. She was prone to hypoglycemia, low blood sugar. The goals for Mrs. Henson are to recognize the symptoms of hypoglycemia and receive immediate treatment. Mrs. Henson mentioned that her first symptoms were usually confusion and mumbled speech. Some people had even thought she was drunk while experiencing a hypoglycemic episode. For that reason, Mrs. Henson wears a medical identification necklace. This would inform others that she was suffering an insulin reaction and was not drunk. Mrs. Henson would always have fast-acting sugar close to her to take if she experienced a hypoglycemic episode. Jennifer was to stay with Mrs. Henson, observe and assist her as needed, and report the episode to Nancy. The second complication was ketoacidosis. Mrs. Henson had a case of the flu. She had been weak, unable to eat, and skipped some insulin doses. Because there was not enough insulin to burn glucose, her body burned fats, resulting in ketoacidosis. Mrs. Henson would do whatever it took to prevent another episode. The nurse would teach Mrs. Henson a plan for sick days. When the diabetic is ill or has a cold or the flu, she must take the usual insulin dose, drink plenty of liquids, make adjustments in diet and medication only with the doctor's directions, call the doctor immediately if there are any unusual symptoms, regularly test blood glucose and check the urine for ketones. Ketones in the urine can be the first sign of ketoacidosis, so ketone testing is important. Nancy assigned Jennifer to test a urine sample for ketones before meals. There are some important hints to remember when performing a ketone test. Store the test strips in a dry, airtight container. Do not touch the reagent or coated end of the strip. Always test before meals. Use a fresh urine sample, preferably a second voided specimen. Do not soak the strip in the urine. Wait 15 seconds. Time carefully. Compare the color of the strip against the color chart on the container in good lighting. Record the results immediately. Since there should be no ketones in urine, Jennifer must immediately report any positive results. Just a few days ago, Jennifer was not sure if she could take care of the diabetic patient. She was apprehensive about the diet, complications, urine testing, and more. However, with the help of her nursing supervisor and the videotape, Jennifer was now more confident. She would follow the home health aide assignment and talk with her nursing supervisor. She had the skills and the knowledge to be an effective member of the home care team and care for the diabetic patient.